Proton therapy is the most advanced method of radiation therapy used to destroy cancer cells. And the world's largest freestanding treatment facility is right here in Hampton Roads at Hampton University Proton Therapy Institute. Joining us now to tell us more about proton therapy is radiation oncologist Dr. Allan Thornton. Dr. Thornton, welcome to the Hampton Roads Show.
Good morning, Chris.
Now, we know that the Institute just recently celebrated a 10-year anniversary. Congratulations on that. And you were presented an award that has to mean a lot to you, especially since you've been there from the very beginning.
Absolutely. It was wonderful to receive it. We're celebrating our 10 years. Absolutely. It was a wonderful thing.
Tell us what that 10-year mark means to you and everyone who works there from your staff, and not just that, but the countless lives that you've saved.
Well, first off, we have to recognize that this is the brainchild of President Harvey, who had the conception of this way back in the mid-2000s, actually. And so this is a big accomplishment for him, not only in the erection of the building, but also the funding of it. But from a personal standpoint, I and my partner, Dr. Sinesi, are delighted to have been able to guide this from the professional standpoint over 10 years. It's been an awful lot of people behind the scene, and I need to recognize those.
I'm glad that you did that. So let's talk more about proton therapy from other forms of cancer treatment. Why is it so important, and what separates proton therapy?
Well, proton therapy is a different form of radiation therapy. Instead of using X-rays, which is electromagnetic radiation, we use protons, we use particles, and they behave fundamentally differently. And what's different about it is we save about 70% of tissue that doesn't need to be treated compared to any form of X-ray therapy. So this is a huge advantage to our patients in terms of minimizing the side effects of the treatment.
Let's talk about what types of cancers can be treated using proton therapy.
Well, basically, any solid tumor that can be treated with X-ray therapy can be treated just as well, if not better, with proton therapy. So any form of cancer can be treated with proton therapy if radiation is appropriate, with the exception of leukemias. We do not treat blood-borne tumors, but lymphomas can certainly be treated.
Can you talk about what it's like for patients who are taking proton therapy and what types of side effects they might encounter?
Well, the side effects really depend upon the anatomy. They depend upon where we're treating. So if we're treating an oral cavity, a tongue tumor, for instance, that patient will have less saliva difficulties, less pain in the oral mucosa, the lining of the mouth, than with conventional therapy. But we also treat a great number of men with prostate cancer, and those gentlemen hardly know they're being treated because we're able to treat just the prostate and completely spare the bowel. So it really all depends upon the anatomy.
Dr. Thornton, you touched on men taking it for prostate cancer. Can you give us a little bit more of the success stories that you see on a regular basis there at Hampton, and what it's like for yourself to see people being cured, and not just yourself, but your staff and everyone involved?
Well, first of all, you have to understand that this really is a family institution here, where I'm blessed to be able to work with a wonderful group of nurses, of technologists who really deal with the patients every day, down to our janitorial staff, Corey and Kavoda. This really is a family operation. And we see our patients come back repeatedly, not only after the therapy, but for many years thereafter. It's very gratifying to see them come back and do well. In fact, I'm having patients that I treated at Massachusetts General Hospital up at Harvard 25 years ago come back and see me once a year. So I get a lot of satisfaction from that.
And it has to feel good to know that you're 10 years strong and saving lives and getting awards along the way. Congratulations to all of that.
Thank you very much, Chris. It's a real pleasure.
Dr. Thornton, thank you for joining us today on the Hampton Roads Show.
Bye-bye.